Okay, and we're going to start on the medial aspect of the thigh, and we're going to start with this muscle just here, which is pectineus. This has a proximal attachment at the pectineal line of the pubis and a distal attachment at the pectineal line of the femur. Its main action, as with pretty much all of the muscles in the medial compartment, is it's an abductor of the hip, and it's also a flexion of the hip joint. Okay, so we're going to move on to adductor longus, which is this muscle here. And basically, this has a proximal attachment on the anterior surface of the pubis between the crests and the pubic symphysis. Its distal attachment is on the middle third, of the linea aspera of the femur. And although it's not very clear, and you're probably unlikely to be asked this because it's so hard to spot, but there is a adductor brevis, which is actually in between the two. So here's pectineus, here's adductor longus, and just in the middle there is adductor brevis. This has a proximal attachment at the inferior ramus, and a distal attachment at the pectineal line and the upper linea aspera again. Its main function is hip adduction and also lateral rotation of the hip. Okay, so we'll move on to adductor magnus, which covers this area here and also this area here. It has the largest surface area of all of the skeletal muscles, and it has two distinct portions. It has a hamstring portion and also a adductor portion. But it's got a proximal attachment at the ischial ramus and the lateral surface of the ischial tuberosity, and a distal attachment at basically the entire length of the linea aspera, and also the adductor tubercle of the femur. Okay, and then lastly we've got gracilis, which is this other classic example of a strap muscle, and basically this has a proximal attachment at the inferior ramus of the pubis and a distal attachment on, if you notice, it's the only one which goes down past the femur and onto the tibia. And yeah, that's just the very proximal part of the tibia that attaches to on the anterior medial side. And the main difference as well of this is obviously because it goes down to the tibia, it also flexes the knee and rotates the knee medially and aids adduction of the hip. Okay, and that's all the medial compartment.